Hey student nurses, so in today's video we're doing something a little bit different. We are looking at inflammatory response to tissue damage. We are looking at the signs that you will see and how to interpret them when they are mentioned in the Latin word, and how to assess your patient and how to escalate this. So let's take it as in a scenario where you've gone for your placement and this is your first week of placement, and usually in your first week you will be allocated to body with your healthcare assistant to work and see the ward routine and also get yourself orientated to the ward. Now, in this scenario, we would say you've gone to support your patient or service user to get them ready for the day, and they have mentioned to you that they've got inflammation, they've got pain to an area, so or an area of their body has become tender, and you had a look, you did a quick assessment, and what were the signs that you noticed? So the signs that you will see in this instant, usually it was four, but they have added one more to it, a fifth sign, and I would love for you to watch the video to the end to know the fifth sign, to be able to recognize when your patient is deteriorating and how to escalate this appropriately and how to document it. So in that instant, let's say you've gone and the patient have said to you they were in pain, you've had a look, you've done the assessment, and you saw there is redness. So the Latin name, I will write these in the how they appear in Latin and in English and what they mean in inflammation, and if also I will add some of the medical terms as well. So you will see rubor, which is also mean redness. So why does this occur? This will occur due to increased blood flow to the area and histamine. Why does this happen? This will happen due to vasodilation. So when there is vasodilation, the tissues around that cell become dilated, allowing for more fluid, in this case blood, flowing to that area. So that red blood that is flowing to that area is what is causing the area to become red. Now you will see something also called color, which indicates heat. Heat in this case also will be the cause of increased blood flow to the area and metabolic activities. So we have talked about vasodilation, that it is when your tissues to the area of that infection, which might cause the inflammation, become dilated and allowing for fluid to or blood to go to that area. So that warm blood that is flowing to that area is what is causing the area to become warm when you touch it, or making the patient feel that there is heat at that area. And then we will talk about what is called tumor. This is also known as swelling and or edema. This will be caused by accumulation of fluid. Now, when too much fluid goes to a place where it engorges to that place, meaning it has attached itself to the place and it's not going anywhere, this is where there will be an accumulation of that fluid, then causing the area to become edematous. So how that looks like is, if let's say the tissue is like this, because of that engorgedness of the fluid to that area, is where when you will see the area is swollen, because there is permeability in that whole vasodilation issue, making that tissue become more leaky, hence fluid flows there. Then it being engorged into that area make it more swollen for you to see. So that is why there is edematous in that area. Now we can also talk about color. Sorry, not color, dallor. We will talk about dallor. So dallor is pain, really. So why does pain occur in this situation? Pain occur due to actions and interactions of prostaglandins and bradykinin. So what the prostaglandins is doing is that it is supporting, trying to help reduce the threshold of the pain, thereby making that tissue around that area to become more sensitive to the swelling, heat, and redness, causing pain. So in this instant, your patient will tell you that, oh, when I move my hand or when I move my arm, the area on exertion, when I move that area, the pain that I feel is maybe 4/10 or 5/10. This lets you know that indeed this service user or this patient is in pain. And what will also cause this pain could be things like lactic acid from anaerobic respiration. That could also cause pain in that area. Now, last but not the least, we will call it when the area is not functioning. So, area you will call it loss of function. Why is this happening? This is taking all the brunt from the 4 signs that we've mentioned: the redness, the heat, the pain, and the swelling. It is taking that brunt from that and causing the place to be immovable, because the redness, which is also known as erythema. So put it in your head, students, if you see that someone has documented erythema of an area, it means redness of the area. So the redness, the heat, the swelling, the pain, the swelling will be more prominent in here, because swelling makes the area not desirable for movement. It is painful. It becomes more sensitive, so the patient will not be able to move that area. And the pain here, we've mentioned that maybe on exertion is 4/10 or 5/10. This is where you will escalate NSAID. You will escalate for the patient to get NSAID, and for the swelling, at this point you will have to elevate the patient area. That area that is swelling, you will have to elevate it. And then for the heat, just open windows, take excess clothing from the patient, just let them get some fresh air. And because you are giving, some of the NSAIDs will cover that temperature from there. And then for the redness, if you elevate it, that area will reduce in redness. So because